There is a cognitive trap operating at the intersection of health aspiration and restaurant menus that costs a significant number of Americans their cardiovascular health incrementally, meal by meal, without their awareness. The trap is the salad, not the modest bowl of dressed greens that the word conjures in the abstract, but the heavily constructed, topping-loaded, dressing-drenched salads that anchor the healthy options sections of major chain restaurant menus. Ordering a salad at a chain restaurant is understood as a responsible health choice, a demonstration of nutritional discipline over the burgers and pasta. The health halo that attaches to the word salad is so powerful that it actively prevents people from doing the arithmetic that would reveal how much sodium, saturated fat, and refined carbohydrates they're consuming. The sodium numbers are where the gap between perception and reality is most striking. The American Heart Association recommends a daily sodium intake of no more than 2,300 milligrams for most adults, with an ideal target of 1,500 milligrams for people with hypertension or elevated cardiovascular risk. A typical large salad at major chain restaurants, the Cobb salad, the chicken Caesar, the taco salad, the so-called power salad, routinely contains between 1,500 and 2,500 milligrams of sodium per serving before you add anything. The sources accumulate invisibly. Commercially prepared dressings are among the most sodium-dense condiments in food service, typically delivering 300 to 500 milligrams per 2 tablespoon serving, and the average restaurant pour is 3 to 4 tablespoons. Croutons, themselves seasoned and baked with significant sodium, add another layer. Cured meat toppings, bacon bits, salami, pepperoni are preservation-heavy with sodium by design. Cheese adds more. The romaine lettuce and cherry tomatoes underneath all of this are genuinely nutritious and genuinely low in sodium. They're functionally invisible under the nutritional architecture built on top of them. Chronic high sodium intake is not a cosmetic health concern. The mechanism linking dietary sodium to hypertension is well established. Excess sodium increases extracellular fluid volume, raising blood pressure through both direct fluid pressure and indirect hormonal mechanisms involving the renin-angiotensin-aldosterone system. Sustained hypertension is the leading modifiable risk factor for stroke, including hemorrhagic stroke, which kills or severely disables tens of thousands of Americans annually, as well as for myocardial infarction, heart failure, and chronic kidney disease. The irony of a person choosing a healthy salad as a stroke risk reduction strategy while inadvertently consuming their entire daily sodium allowance in a single meal is not an edge case. It's a systematic product of the health halo effect operating in an environment designed to obscure nutritional reality. The behavioral psychology behind this is precise. When people believe they've made a virtuous food choice, they lower their cognitive guard against the specifics of that choice. They don't read the fine print. They don't scrutinize the ingredient list. They assume the category validates the product. Restaurant industry design exploits this systematically. Healthy-sounding names, green color schemes, words like fresh, natural, and seasonal on menus all activate the health halo without requiring any specific nutritional claim that would trigger regulatory scrutiny. Chili's front-of-pack black stop sign labeling system, mandatory for products exceeding defined thresholds of sodium, saturated fat, sugar, or calories, represents a regulatory approach that disrupts this dynamic effectively. And its absence from American food labeling is a public health policy failure with measurable cardiovascular consequences.